It's time now for Countywide, a special presentation of Yavapai Broadcasting News. Join News Director Paul David and News Editor Philip Katafamo as they talk with our community's leaders, newsmakers, and people in the know. You'll hear about the hot topics in Yavapai County that affect all our lives. And now here's today's Countywide.
Ladies and gentlemen, welcome to Countywide. I'm Paul David. I have two guests in studio with me today over the phone, Yavapai County Community Health Services spokesperson Terri Farneti and epidemiologist Stephen Everett in studio. Welcome.
Thank you.
First of all, website, yavapai.us, coconino.az.gov. Some of you might notice Countywide is a little different. We're doing it over the phone now because, of course, social distancing. It's not wise to be bringing people into the studio with us to do the show. Phone number for you is 1-844-542-8201. Let's get right into it. Whoever wants to answer this question, I noticed over the last several days that the number in Arizona is kind of jumping on a steady pace. And I hear a lot of the testing's no good. The testing's no good. These numbers are no good. They don't tell us anything because they're so old, these tests that were taken. Can you talk a little bit about the testing procedure, and is it going well? Do we have enough tests, and so on and so forth?
Oh, not in the least. We have very few tests available. We need a lot more. So we're simply not testing enough people we really should be doing. Right now, we're only testing people who are hospitalized or people who are just lucky enough to get tested when we have the few kits we have actually go out to the doctor. So it's not really a very good representation of what's going on in Yavapai County.
Okay, so basically, I guess what I'm getting at is there's bound to be more cases that we just don't know about yet because there's still tests out there that we're waiting on.
Absolutely.
And that's
we have really no idea if it's being transmitted in the county or to what extent. We have a slight idea in that the few cases we've actually had tested through the hospital have all come back negative. The few cases we've had 3 so far in the county. We've interviewed 2 of them. One was asymptomatic and one had mild symptoms. Neither had to be hospitalized. So we're missing a lot of those cases.
Now, these tests that we're using, these tests haven't been sitting around and just waiting in a closet somewhere to come out and be used. They have to be made with the current coronavirus. They couldn't have just miracled these right up.
Yeah. Well, when we say test, it's kind of actually 2 things. There's a collection kit, which is a plastic swab with what's known as viral transport media. The medical provider will stick the swab up the person's nose, way into the back of the nose, rub it around a little bit, put it into the viral transport media, then it gets sent to the lab for testing. The testing portion of it is fine. We're just running really low on the swabs and the media.
Oh, wow. Now, how long does it take for that? Once you swab someone, how long does it take to get the results of that swab back?
Oh, it depends on the lab, because some have to send out of state. So, like, for example, LabCorp sends out to a central lab. They're building a new one here in Arizona, down in Phoenix, so they'll be able to make a faster turnaround. So it can range from 2 to 3 days up to 5 or 6 days. But usually we get them in about 3-4 days.
Wow, that takes some time. So we're just now developing our lab in Arizona that's going to be able to handle this kind of thing down the road.
From what I understood on a call I was in, that the LabCorp Phoenix lab was setting up and should be up and running now, so they should be able to be turning those tests around quicker. LabCorp anyway.
Do we still need to test people?
Yeah, because we need to know what's going, where we're seeing cases, if something else going on. It's still flu season. So we're still seeing flu cases, so we want to determine, is it flu, is it COVID, how many people are, mild symptoms or having no symptoms, get more information regarding the people that are being affected.
How about the resources to keep everyone a bit safer dealing with COVID-19, like yourselves and people in the hospitals and so on?
Well, social distancing, of course, is probably one of the keys. You want to stay at least 6 feet away from people, and you want to practice proper hygiene, which, as you know from all our flu interviews, is always the same. You want to wash your hands regularly with soap and water, at least 20 seconds. You want to cover your cough. You want to stay away from sick people, and you want to if you're sick, you also want to stay away from healthy people.
What about the hospitals, though? Do the hospitals have enough gloves and masks and gowns and things of that nature? I keep hearing that there's a shortage of that right now. And I even heard, I think, over the weekend that there was somewhere like in New York, there was a clothing designer that offered to take everyone that was at home sewing to make masks instead of sewing the clothes that they're selling, and to make masks instead. Are we short on all that stuff for the hospitals and clinics?
Currently, we're not too bad. We are starting to see shortages. We are distributing to medical providers. Right now, the hospitals are still doing okay, but it's just a matter of time before they're running short. So, yeah, medical PPE or personal protective equipment is going to be in short supply probably very, very soon. So it's really important for people. Try to make alternative means for your own. Let the hospitals, let the first responders have the N95 masks, the gloves, the gowns.
My wife over the weekend was saying, a bandana works. Maybe a scarf tied around your mouth would work. I guess anything's better than nothing. Is that right?
Right, yeah. A bandana doesn't work as well as a surgical mask, and especially as an N95. N95s are only good if you're fitted for them. Otherwise, they're just a really expensive surgical mask. But a surgical mask is best. A bandana is not perfect, but if you're sick, it's better than nothing.
Okay.
Anything that keeps you from coughing and sneezing out into the general atmosphere really helps a lot.
I'd like to add to that
Sure.
the Emergency Operations Center, the Yavapai County Emergency Operations Center, is up and running, and they are the ones who allocate the resources out to the hospitals that are top priority, or first responders, at clinics, and then doctors. So they have received a partial shipment today, and they are allocating those out to those people that are high priorities in Yavapai County.
That's good to hear.
Yeah.
That's really good to hear. Now, Stephen, I had you in February, and I did a story with you in March, both about COVID-19.
Yeah.
We had you set down for 20 minutes, and we were talking, and at that time, I think it was still Wuhan, China, and it was moving into Europe, and it was starting to spread, but I don't think we took it quite seriously. I mean, a lot of us didn't take it very serious, just how fast something like this was going to move. Why does this one move so much faster than, say, just your regular flu, which the symptoms seem very similar to?
Well, I think it moves faster because it has a longer incubation period, and people can spread it while they're still showing no symptoms. So, say with the flu, it usually kicks in about 2 to 3 days after getting sick, and then you kind of feel really lousy and don't go anywhere. Whereas this one, it doesn't usually kick in until around day 5, day 6, and so that means you're walking around 3 to 4 days ahead of time, just spreading the virus. And what's really unusual is people can have either really mild symptoms or absolutely no symptoms whatsoever. So they're not even aware that they're sick. They're walking around and they're spreading it without even realizing it.
As an epidemiologist, what do you think of this guy, COVID-19?
It's definitely a different one. It's totally different from flu. I mean, a lot of us epidemiologists were expecting the next pandemic to be flu. And so this one really came out of nowhere. It's similar to SARS, which we had about 10 years ago or 5 years ago. And with that one, it just kind of mutated itself out of existence. So we haven't seen a case since, whereas this one just keeps going and going. So it's really something we can't really make predictions on because we've never seen it before. So it's really, really a totally new game.
Let's take our first break with the Yavapai County Health Department. A couple of websites for you, yavapai.us. Also in Coconino County, you can go to coconino.az.gov for information about COVID-19. And I'm talking about just looking at the state of Arizona in general, not the world, not the entire, just the state is what I'm looking at. Phone number for you, 1-844-542-8201. This is countywide. We'll be back in just a couple minutes.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle. Get Gettles.
Hi, this is Greg at Verde Solar Power. You know, Arizona has lots of clean, renewable sunshine, and we want to help you take advantage of it with our quality solar installations, and we offer to beat any written offer on a residential solar electric system. So bring us your electric bill and let us show you how solar power will save you money. We're located conveniently here in the Verde Valley and are dedicated to helping the valley go solar. So remember, the energy solution comes up every morning.
So I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
Orkin has pest control down to a science.
When your business chooses Orkin's Precision Protection Program, you get a tailored pest control program for your specific industry and environment.
Your business can benefit from over a century of experience, training, and scientific knowledge that define the Orkin man.
Maximum protection, minimum exposure, backed by one of the industry's most comprehensive guarantees.
Choose your locally owned and operated Northern Arizona Orkin and get more than an exterminator. Get an expert.
Welcome back to Countywide. I'm Paul David, sitting down with the Yavapai County Health Department to talk about COVID-19, of course. Yavapai.us/CHS for Yavapai County. That'll take you right to the Health Department's website. And then coconino.az.gov for Coconino County Health Department. Phone number is 1-844-542-8201. And Terri, you mentioned when we took a little break there that Governor Doug Ducey actually, we have a statewide number, 211 for people.
Yes, the COVID-19 hotline is being called, and it's administered by 211 Arizona and the Crisis Response Network. The line will respond to calls in English and Spanish and will provide important information, including how to prepare for and prevent the COVID-19 spread, testing information for COVID-19, what populations are at a higher risk, what to do if an individual gets sick, COVID-19 in animals, and a list of websites with accurate, reliable, and up-to-date information.
Now, I saw that, too. COVID in animals. Is that something we have to be concerned about?
Not really. COVID's a whole big family of viruses, and what they're thinking is possibly that this came from an exposure to an animal that just carries it naturally and doesn't have any problems with it. There's several coronaviruses that circulate around that just cause the common cold in humans. And just this one's totally different. A lot of times, a virus in animals, they tend to be very particular on what they like, so they'll stick with various animals. Probably a good example is E. coli. We have E. coli occurring naturally in our gut, and we actually need it in there for proper digestion and things like that. But if you remember the E. coli 0157, which is the one that causes the sickness, that they have to make sure you have to cook your burger all the way through so you don't get it.
Mm-hmm.
That's actually found naturally in cows, and that causes them no problem. It's the jump from cows to humans that's where it causes the problem.
So we're not making
it similar to COVID-19. In the animals, it may not even cause that many problems, or just maybe a minor cold. But once it jumps to another species, that's when it causes the big problem.
So I don't have to worry if I get COVID-19 and I'm at home with my 2 cats and they love to sleep on me and make a blanket out of themselves for me. I don't have to worry about them getting it and coming down with COVID-19 as well. Because I know people out there are going to be really concerned about their pets as well.
Right.
Yeah.
It probably doesn't transmit. I can't say for certain because, it's a totally new virus.
Sure.
But most likely you won't be able to transmit it to your animals and have it really take and get them sick.
I sit with my cat as well, and I'm not worried about him at all.
Okay. I wasn't either until I saw the 2-on-1. I thought, pets. I thought, I hadn't thought about whether or not my cats could actually get that. But, okay, that's really good to know.
Yeah.
Social distancing. I have noticed there is a lot less traffic everywhere, a lot less people everywhere. It seems to be working. Is it working, do you think?
I'm sure it's working in some places and not in others. It was funny. I was kind of surfing around YouTube last night, and they had a live cam of Times Square, and I could count the people in Times Square on one hand. So that kind of shows the effect it's having, in New York, where it's constantly filled. But, we're still seeing people. There were like hundreds of people out on the trails, which is pretty good because it's outside. If they're keeping space, it's great. But we're still going to see areas centered. There's people who think, this won't affect me. Some people still think it's a hoax. Our younger generation still have that, typical teenager, I'm immortal theories going about in their heads that we all had when we were younger, too.
Sure.
So it depends on the person. And of course, then there's those other people who are just going off the totally different way and are totally isolating themselves, totally afraid. And that's dangerous, too, because you isolate yourself. You're not getting the contact with other people. We're social creatures. So if you're isolating yourself, make sure you call your friends, write them, talk to them on the Internet. Don't isolate yourself where you're absolutely having no contact with people.
We were talking about that this weekend, that it's time for face cam parties where you set computers up with little cameras and then you can get together with anybody you want to and have a little thing right there. So
yeah, Zoom is very popular right now. I was just at a friend's yesterday, and they had set one up, and she must have had 10 people on that call, and you can see their faces and have your happy hour that way.
Exactly. One thing I want to talk about a little bit, too, that we've not mentioned, there's a lot of people that are having a lot of anxiety and worry about this COVID-19. Is there a place they can go to find some help to just kind of relieve their minds and maybe calm down a little bit?
Absolutely. A lot of there's the Arizona Warm Line. I don't have the number right here ahead of me. But you can call them. They're there to help with anxiety. It's not like a suicide hotline where it's really intense. It's for people who are just having anxiety, having problems dealing with the situation. A lot of our behavioral health centers have lines like this where you can call in and talk to a professional to get help.
That's good. That's good, because I know that's going on out there. Let me ask you this one, too. One thing I don't know about COVID-19, because I was waiting for you guys to tell me, but how long does this thing live outside of us?
I've seen different numbers. Like I've been saying, it's a fairly new virus.
We don't know yet, do we?
It's not really sure. I've seen as high as 8. I think the last number I saw was about 5 days. It depends on the surface, too. On hard surfaces like countertops, it'll last longer, while on soft surfaces like clothes or paper, it doesn't last as long. But it lasts about 5 days.
That's a long time to be stuck to something. A lot of people walk by. Yeah.
Yeah, that's why you really want to make sure that you sanitize any commonly touched surfaces, countertops, doorknobs, faucet handles.
Anything like that.
When you wipe them down, make sure it's with something that works against viruses. It usually will stay right on it. And when you wipe it down, make sure it air dries. Don't wipe it down. Don't wipe it off. Don't blow on it so it dries faster. The longer it stays wet, the longer its contact with the virus, and the more virus it'll kill.
Oh, that makes sense. That makes a lot of sense. Okay. All right. Is there anything in particular we're looking for in the cleaner, the sanitizer, a certain chemical? You said that usually it mentions it.
Yeah, there's lots of different chemicals. It usually will say, say Lysol. It'll say right on it, it'll kill 99.9% of viruses. So it'll say right on the bottle whether it's effective against bacteria and viruses right on it. If you're in a jam, what you can do is just a simple 10% bleach solution, just 1 cup of bleach, 9 cups of water, and you can use that. And again, you wipe things down, let it air dry. But when you do make it up, only make up as much as you're going to use, because it's only good for about 24 hours.
Okay.
So don't make like a big 10-gallon jug of it and expect to use it over the next week, because it will lose effectiveness over time.
Gotcha. Okay, so a small spray bottle and make it a few times a week then. Okay.
Exactly.
Let's take our second break. Sitting down with the Yavapai County Health Department talking COVID-19. Yavapai.us/CHS, coconino.az.gov. Phone number for you, 1-844-542-8201. Or you can call the governor's new line of the state. That's 211. Very simple to remember, 211. Countywide back in just a couple minutes.
Starting in the late 1920s, Grandpa Gettle and his brothers laid the groundwork for what would become a family legacy. Almost 100 years and 100 patents later, Gettle's High Desert Mechanical continues to raise the bar of quality heating, cooling, and plumbing products and services in the Verde Valley.
Call Gettle's High Desert Mechanical Heating, Air Conditioning, and Plumbing at 567-2200 or online at GettlesHDM.com, providing solutions for your comfort. Don't settle. Get Gettles.
Hi, this is Greg at Verde Solar Power. Arizona has lots of clean, renewable sunshine, and we want to help you take advantage of it with our quality solar installations, and we offer to beat any written offer on a residential solar electric system. So bring us your electric bill and let us show you how solar power will save you money. We're located conveniently here in the Verde Valley and are dedicated to helping the valley go solar. So remember, the energy solution comes up every morning.
So I just moved in with this family, and it's embarrassing. The little one, he likes to go outside and crawl around in the giant litter box. I don't know what he's doing. I mean, I was born and I knew how to use the litter box. Look at that. That's disgusting. Oh, poop already. You're making me nervous. Oh, okay, I can't look at this anymore. I really hope he grows out of this, for his sake.
Orkin has pest control down to a science.
When your business chooses Orkin's Precision Protection Program, you get a tailored pest control program for your specific industry and environment.
Your business can benefit from over a century of experience, training, and scientific knowledge that define the Orkin man.
Maximum protection, minimum exposure, backed by one of the industry's most comprehensive guarantees.
Choose your locally owned and operated Northern Arizona Orkin and get more than an exterminator. Get an expert.
Welcome back to Countywide. I'm Paul David. Just a few minutes left in the program. We're sitting down with the Yavapai County Health Department talking COVID-19 today. Is there, I asked Leslie Horton this last time we had her on, but is there anything the Yavapai County residents can do to make life easier on the hospitals, which, are they overwhelmed right now?
As far as I know, they're doing okay. We're not seeing too many cases. Best thing to do is, unless you have severe symptoms, stay home. If you're just having the mild symptoms of, a fever, sore throat, cough, stay home and recuperate there. You only want to go to the hospital if you're showing more severe symptoms like shortness of breath, tightness or pain in the chest, or if you're showing altered mental status where you're confused, not thinking right, or if you're suffering from hypoxia, which is when your face or lips or fingernails start to turn bluish, meaning that you're not getting enough oxygen.
And you need to call ahead when you do that.
Anytime you want to go see the doctor or the hospital, call ahead, let them know you're having respiratory symptoms so they can take proper precautions.
Meet you at the door when you get there. All right.
Yeah. There's also one other thing. There's the CDC put out a coronavirus self-checker. That is very helpful. People can go to just Google coronavirus self-checker, and they can actually put in their symptoms and everything into that, and that will give them some advice.
Real quick, last thing. Do you guys see these numbers going down anytime soon, or are they going to keep going up?
Oh, they're definitely going to keep going up. We'll be seeing, this is just starting. We're going to see a lot larger numbers. Actually, we may see a lot larger numbers because without a lack of testing, we're not going to know. But we're going to see a lot more cases, without a doubt.
All right. Terri Farneti, thank you so much. Stephen Everett, thank you.
All right.
That is today's Countywide. As always, thank you so much for watching and listening, and we'll talk to you again next time.